So when baldness starts, it rolls out from the crown outwards. It starts first with minor skin show in the crown area, and slowly it progresses to a stage when skin begins to shine under a light. And slowly all the hair in its path, in a radial centrifugal fashion, starts to thin out till the crown becomes completely bald. It looks as if the crown area is the central processing unit of the progression of baldness. In about 36% of patients, baldness starts from the crown area. No matter whatever amount of hair you fill into the crown, a patient is seldom satisfied with crown coverage. Now you can see in this patient, he received for his grade 4 pattern baldness around 3,500 scalp grafts, and a decent result followed in the crown area as well. But the patient is still not happy. He feels that when light falls on his crown, the skin should not be visible. No amount of counseling, no amount of reasoning with the patient, telling him that you have to conserve your grafts for future use. Only then you can meet your future goals and objectives, because baldness is a progressive thing. Hair transplant does not stop the progression of baldness. But no, they will not listen in many cases. So in this case, a couple hundred grafts were put and the patient was satisfied. Otherwise, he has a reasonable result for his grade 4 baldness. I often wonder why patients are more bothered about the crown area being bald than the hairline. Many patients start by saying that I would first like to cover my bald area and then do the hairline. And then you have to talk them out of it, because crown is always the second priority. You can never fill the crown with very high density. There will be hell to pay as baldness progresses. The crown, someone said, is the black hole of surgical hair restoration. It truly is, because we are not playing with limitless supply of grafts. There is a limit to the grafts available in a particular person. And if this person comes at a young age, we do not know which way his baldness will progress. Conserving grafts and wait and watch is the policy that you have to incorporate in your surgical plan if you have to make this patient happy for a longer period of time. So that was about this patient, this young patient, 35 years old, who came for his grade 4 hair restoration, otherwise very well pleased, but for the crown show under the light. So thank you for watching, and we'll be back with the next video very soon. God bless you.